and we're ready.
Okay, I'm going to go ahead and open it, and then it'll be another maybe 30 seconds or so before the Facebook stream starts.
Perfect, thank you. Good evening. Good evening, everyone. Thank you for joining us. Welcome to Alameda County's Safe Schools for All School Health Panel. We're excited that you've joined us, and we look forward to a great dialogue this evening. I'm your moderator, Kimberly Brown, and I work on the Safe Schools for All awareness campaign. Tonight's panel is targeted to African American and multicultural parents in Alameda County. Our goal is to provide you with critical updates and information regarding your students returning safely to in-person learning this upcoming school year. Before I introduce our illustrious panel, I want to quickly go through the agenda and just some general information that I'm sure you're familiar with, but just want to make sure I cover. So we'll talk about general instructions. I'll introduce the speakers very briefly, and then the speakers will speak to you for about 4 to 5 minutes and greet you, and then we'll move directly into the question and answer period. During the Q&A, your questions should be submitted via the Q&A function. You should all be able to see that. We encourage you to put your questions in. We will get to as many questions as we possibly can. If you just have a comment, if you just want to share a thought, please feel free to put that in the Q&A as well. We're sharing those as well because we just want everyone to be able to express themselves. Today's speakers are Dr. Naomi Burdock, who is the Safe Schools for All team lead. We're also joined by Dr. Daryl Camp, who is the superintendent of San Lorenzo Unified School District. We have Lk Monroe, who is Alameda County Superintendent of Schools. Dr. Lee Atkinson McAvoy, who's Chief of Division of General Pediatrics at UCSF. And Warren Parker, who is a counselor, a school counselor at Dublin High School. They're excited to share some words with you as well as engage you in the Q&A. And with that said, I'm gonna stop sharing my screen and I'm gonna turn the table over to Dr. Naomi Burdock, who has a brief presentation.
Much. I'm just gonna share my screen, 1 second. Oh, and it looks like the host disabled participant screen sharing. If you don't mind enabling that, that'd be great. And in the meantime, I would also just like to give a big welcome and thank you guys to everybody who's coming in the audience, the parents, anybody who's sort of joining us tonight, and of course the really fantastic panel of people, leadership, medical, educational. We are all in it together. The best way to support our schools to be safe and successful this year is to do it together. So thank you everybody for joining us today. And I will try and do a screen share. Perfect. I'll get to the top. I'm Dr. Naomi Burdock. I'm the lead of the Safe Schools for All team. That's the Safe Schools for All team is for the state of California, supporting schools to do safe and successful reopening and opening in the 2021-22 school year. I also bring the perspective both as a parent of an 11 and a 13-year-old, and then also a pediatrician for kids at San Francisco General Hospital, the county hospital, so African-American, Latinx kids, who really, in the beginning of the pandemic, it's taking care of those kids as in addition to my own, where I really felt like I needed to better understand how can we do this schools right for kids. It was clear that like they need to be in school. We are in a tough spot. We had to figure out how are we going to deal with COVID and how are we going to support our kids to be in school, and particularly those kids who are getting disproportionately impacted by the pandemic. So those are the things that I bring. It's what drove me to come here and to do this work, and hopefully bring a lot of focus on how to do it right. So the last thing is I wear a hat that is a health services researcher hat, or somebody who thinks about the science all the time. And so I'm never saying like, oh, here's what I want to be the right answer. I'm always looking to see what are we learning? What can we know? We don't know the right answer yet. So I'm not trying to find like, oh, this is a piece of information that tells me the right thing that I want to hear. I'm always trying to find what is the thing that we really need to know about how to do schools right. So those are the sort of perspectives I bring. And then I wanted to tell you guys a little bit about the Safe Schools for All initiative. So that's the state level initiative. It started in December of last year in order to support schools during the pandemic. It has 4 different pieces to the framework. There's funding to support safe schools, because we know there's a lot of sort of complex things that have to happen, and you need extra dollars in order to do it right. We also provide hands-on assistance, because just giving people dollars and asking them to do complicated things, particularly because it's public health stuff that schools don't normally have to do. So there's a lot of hands-on assistance trying to help people understand what are the guidance and how are we going to do it? What's the best way to do it for kids? And then safety measures, tangible things like, things like actual things. So masks to help with protecting transmission, so that kids don't transmit to each other and adults don't transmit to each other or to kids. And then also testing resources, so the actual test kits and software to help support testing, which I'll talk a little bit about later. It's another great layer, and so the state is actually providing those tangible things as well. And then finally, transparency and accountability, which is like we can't just sort of do this all in our own silos and by ourselves. We got to build up some trust and understand what's going on the ground. So there's a website that actually gives tons of information for folks, particularly focused on parents, but also for schools and for public health folks about how to do schools. And then there's also an interactive map where you can look up your own school district to see how much money did you get? Were they last year, was it open or was it not open? And also what kind of outbreaks might be happening on the ground. So just transparency information for people to be able to know and understand what's going on. And then the final part is equity is core throughout all those 4 pieces, really thinking about how do we get funding? How do we get resources to schools, particularly in communities of color, communities that were already disproportionately impacted? Like, a lot of stuff is happening in communities, and we don't just want to say, oh, let's treat everybody equally. We want to make sure those communities get more in order to be supported in the way they need to be supported. And then finally, state and local safety efforts. So we know it can't just be the state says one thing and the locals just have to go do it on their own. We're all, like I said, we're all in it together. And so really the philosophy is that it's a collaboration, it's understanding, it's bi-directional, and that's the other sort of piece of the Safe Schools Initiative. So just a little bit more about the funding piece. School safety and kids, over $25 billion, actually $25 billion, that's a lot of money from the federal government, so the sort of national government as well as state government, to support safe schools, the schools in California, including things, very specific things, masking, ventilation, which is about airflow in the classrooms, COVID-19 testing, extra cleaning. And then in addition to those public health things, those, how do we keep things healthy? Also really important, extra instructions, making up for learning loss, social, emotional, and mental health services. Those dollars are supporting all of those things. And then finally, a strong safe schools network between county education and health departments is also supported by some of those dollars. So what do we know about schools since the beginning of the pandemic? We've learned a lot. The bottom line is that the research shows that schools can reopen safely and can stay open. And sorry, I'm a pediatrician, so I put this picture up here, but the key question from the very beginning is that we thought that kids would spread COVID-19 like they do with other viruses. Like they have coughs, they have colds, they pass them around. Every parent knows that part, right? This is a really big question in the beginning, and is part of the reason that all the schools shut down. But it turns out that kids do not get COVID-19 as often, and they don't get as sick as adults. Why? Why would that be true? Why would they get it less often and get less sick? This is based on information that we got out of a research study from early in the pandemic about ACE2 receptors. ACE2 receptors are the doorways, the entryways for SARS-CoV-2, the virus that causes COVID-19. You don't have to remember the name ACE2 receptors, just remember they're the doorway in. Our ability to make those doorways varies with age. With elementary school students, having less ACE2 receptors or less doorways compared to middle and high school students who have less doorways compared to adults. So the implications or the take-home point is that there are fewer, if you have fewer doorways, then you have less disease and more mild disease. The other thing we learned is that most school-age children get COVID-19 from household adults. And that's been shown consistently in Greece, Australia, China, Switzerland, Chicago, around the world. And it kind of makes sense when you think about it, because we have really close contact with family members in homes, much more so than in schools, right? We take off our masks, we're eating together, we're snuggling. So the take-home point for that also is that vaccination for adults, home adults, but also the teachers and the school staff, is key to prevent infection in kids and provides a wraparound layer of protection for them in the schools. And then finally, we know, again, from studies around the world, in the US, also in California, that schools can operate safely when there are key safety measures in place. And this is a picture of the Swiss cheese model. So the Swiss cheese model is talking about layers, and that if you turn all the layers of the Swiss cheese and the holes don't line up, then you can really prevent the virus from passing through. And this is what we do in schools. We use these layers to prevent that transmission and make for a safe school environment. So let's talk a little bit about the upcoming school year. The real focus is the priority on a safe and full in-person learning for kids in school this year. We want to support their education, their mental, emotional, and social health and development. And so the key pieces in the guidance, so we came out with this with the California Public Health Guidance that sort of guides stuff for the whole state. Each area might have slightly different ways of how they're using that guidance, because you can do a little bit more than what's given in the guidance, but the guidance basically provides some basic key ideas. What is it that we're doing in the schools? It aligns with the guidance also from the Centers for Disease Control and Prevention, as well as the American Academy of Pediatrics. Again, very based in the science. Those are two big national leaders in the science. And so I'll go over the layers that we're talking about one by one. Vaccines. We know that vaccines are a game changer in COVID-19, not just for schools, for everyone. They're safe and effective in preventing COVID-19, and anybody 12 years old and older is eligible. We know that the vaccine is our way out of this pandemic, and that the more people who are vaccinated, it's because the less the virus can spread and get unvaccinated people sick. So it's one of our key layers. Another key layer is masking. There's a universal mask requirement in schools for adults and for students. Indoors, it's required. Outdoors, it's optional. Some people are still using it. I've talked to a couple school districts around the state. Some people are still having people mask outdoors, but it's required in the indoors according to our guidance, and it's optional in the outdoors. And just, sorry, one other thing about masks, they're one of the simplest and most effective layers that we have to create that safety layer in school, because the virus is airborne, it passes through the air. And so that mask actually stops that virus from moving out, and particularly it stops moving out like really directly. It's sort of, you know, it just doesn't pass through the air because that mask is creating a good barrier. And then the ventilation, that's an airflow. Like I said, that's airflow in classrooms. And we know that if you're doing good ventilation, you're moving clean air in, and you make the indoors more like the outdoors. And sorry, to explain, that also is why there's a difference between indoors and outdoors for masking, because it turns out that outdoors is actually a lot safer. It's just much less likely to get COVID if you're outdoors compared to indoors. And good ventilation makes the indoors more similar to the outdoors. Hand washing, it's always a good thing to do. It can help prevent infections from spreading, including COVID-19. Staying home when sick is, we know that you can have, that people with COVID-19 often have symptoms, not everybody, but you can often have symptoms. Staying home when sick and getting tested to double check, is that COVID-19 or not, really, really helpful. It's a great way to prevent passing whatever is making you sick along. And then it's really a great way to take care of not only yourself, but other people. So staying home when sick or keeping your kid home when sick protects them, allows them to get better, and then also protects other people if they have COVID-19. And it turns out that, you know, kids can have pretty mild symptoms. So even like a runny nose is actually can be a sign of COVID-19. Testing, like I mentioned before, a really effective layer. It it can actually detect the virus before a child or a staff member is actually feeling any of those symptoms. And so schools can do regular testing with unvaccinated students and teachers. It helps people stay safe in school and prevents those cases from even coming onto the school campus. There's over $1 billion in testing, $1 billion for testing for schools alone in California. So a lot of support, very different from what it was last year. So it allows us to have an extra safety layer, particularly if community case rates are higher, that schools have access to this, to testing, and it's free testing in the schools. Transparency, the last layer, really important. Trust is a huge thing of being able to work together, right? Collaboration and working together against this virus requires some transparency. So it's also part of the guidance is to support people to say, you know, share your safety plan. A lot of schools are posting their safety plans, sending them out to schools, sending them out to parents. And this webinar in particular is also to support families to feel like, oh, I have the information I need to know what the questions are and to ask for that safety plan and better understand sort of what a school is doing. I want to spend just a minute or two also talking about the COVID-19 Delta variant, which is a new version of the virus that is different from the original one, which many people have heard about and are talking about and have questions about. So it is a worrisome variant because it's more contagious, but we have some key tools. So we also know that hospitalized patients tend to be adults. And the vast majority of them, almost all of the hospitalized patients, are unvaccinated because the vaccines are actually very effective even against the Delta variant. They help to slow the spread. And even if you get the Delta variant, if you are vaccinated, which can sometimes happen, those are called breakthrough infections. They're relatively infrequent, but they can happen, but they really protect you from not having bad symptoms with it, which is why the people who are getting hospitalized are the people who are unvaccinated. The one other thing is that it's important to be fully vaccinated with Delta. If you're somebody who's has a vaccine that has those 2 doses, that second dose is really important, particularly for Delta, that having that second dose is what completes the protection. And of course, keep wearing those masks. The masks, like I mentioned, simple and effective and helpful very much in Delta variant as well. So this is just a picture of our key layers. Vaccines, 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 vaccines. You probably have heard enough about it, but it's just because they're really important piece of how we're going to get through this pandemic. Masking also super helpful, ventilation, testing, and stay home when sick. And then just to end, this is a resource for folks. The Schools Hub and Parent page. So the Schools Hub in general, you can see the link at the bottom, gives lots and lots of information. And we have a specific parent page actually to help give resources to parents to understand and to ask questions and to feel like you have some resources. And thanks so much. I'm really looking forward to hearing what the rest of the panel is going to share tonight. And we'll be doing questions and answers at the end. Thanks so much.
Thank you, Dr. Bardock. We're going to move on to Dr. Daryl Camp.
Good evening. I'm Dr. Daryl Camp, and I'm the superintendent of the San Lorenzo Unified School District. And I just want to say first off, kudos to you for attending this evening, and kudos to every parent and guardian and family member that's tried to support students during this pandemic. I know as an educator for almost 30 years, this has been one of the most difficult periods in the education system that I've had to work through. And that means as an educator and as a parent. I too have kids, one being 21 years of age and one just hit 18. So yes, my 18-year-old experienced his senior year during the pandemic. And I know it's been extremely challenging. Once again, as an educator and a parent, I'm talking. I can say I'm happy that my 21-year-old was able to, suspend his time in college and end up experiencing his Morehouse College experience remotely. And he was able to persevere and progress. However, it impacted him clearly. You could see the time lost away from his peers was not a good thing. It just was not a good thing. We did what we had to do for public health and public safety purposes, but it wasn't a good thing. And then as an educator here in San Lorenzo, I've talked to a lot of parents about how the pandemic was a struggle for the kids. We heard stories about students that used to be motivated some highly motivated to come to school and do well on a regular basis. And then it became a struggle for parents to get the kid up and go to school. And that was when go to school was get up, click on a link to attend the class. That was go to school. So I really, Dr. Bartik did a fabulous job of talking about the health implications and the health perspective. And I'm just really want to share those stories about the mental health and the social health of our students. That's where I think it's critical. I'm thrilled though. I'm thrilled that we have a network in Alameda County under the leadership of Superintendent Lk Monroe for convening and with the health experts on a weekly basis. And as a group of superintendents, it was every other week we've been talking with health experts and among ourselves about what we can do in order to support our students. Once again, when we are in virtual learning and definitely now as we get back to in-person school. So I'm thrilled. I can't tell you how excited I am that I'm going to be able to roam around and see kids learning in the classroom. One student told me at the I think it was a little 7-year-old told me at the beginning of the pandemic, he said, you know, when we don't want to go to school and you tell us you have to go to school, I don't like that. But when you tell us we can't go to school, that's horrible, right? I was like, oh, okay, yeah. And he missed school once he couldn't go to school. Once that privilege and that right was taken away, he was communicating that this is hard on me. So we're doing everything we can as a school system to support our students. That's reasonable. Obviously, we have some resources restrictions, but the same strategies that Dr. Bartik spoke of. Yeah, vaccinations were made available for educators early. I want to say relatively early, that March time period, maybe in the pandemic, maybe late February. What you'll see when you visit many of our classrooms, you'll see these hand sanitizers all over the place. It's almost hand sanitizer for everybody. We're encouraging our staff to use outdoor spaces with the philosophy outdoors is better than indoors. And we've used some of those one-time funds in order to support that. Yeah, students will be and staff will be expected to wear a mask as well. That we see as one of those, it's critical. It's mandatory at this point, and it's a good thing. Somewhat inconvenient, especially when it gets hot, but when you think about public safety and weighing that with getting kids back in school, I think it's a minor sacrifice. That's editorial comment. So once again, we're looking forward, and not only that, my last point is this: Dr. Bartik talked about the importance of vaccines and getting vaccinated. We in San Lorenzo, and I know other systems as well, are really looking into partnering to make sure we can vaccinate as many of the 12 to 17-year-olds to make sure that even though we're not responsible for vaccinations, we want to work in partnership with our community-based organizations to make sure that the vaccines are available. So for us, I know we've worked with La Clinica and Tiburcio Vasquez Health Centers, and we're trying to partner to make sure that when we have our opening school events, that a parent can pick up a registration packet, a book, maybe a Chromebook, and get a shot in the arm, all at the same time. That's our goal. And once again, we know that it's a personal choice for a family, but we want to do everything we can to make the vaccines available should the family make the choice to. And the editorial is I'm listening to the health experts all the time. It appears like the vaccine is one of our best strategies. My concern was when I look at our data in Alameda County, the vaccination rates when we disaggregate it by race in Alameda County there's a difference. On the low end, African Americans around 23%. On the high end, our Asian American 12 to 17-year-olds around 66% are fully vaccinated. So once again, I can't make people get vaccinated, and that's not my intent. I just want to make sure that it's available for people that make the choice to get the vaccination. So contact the schools if you have an interest, and the schools are working with the community-based organizations in order to make sure it's accessible. And I just encourage the communication. And with that, I just turn it back over. And I think we're going to hear from the star, Superintendent Lk Monroe, next.
Perfect segue. There's the introduction to Lk Monroe.
Thank you so much. It's a pleasure to be here. It truly is. This is a really important convening. I don't think we can have this conversation too often. And I am glad to have made new friends virtually this evening, but work all the time with, of course, Dr. Camp and with Dr. Bardock as well. I have the privilege of serving this year as the president of the organization of the 58 county superintendents for the state of California. We are also meeting weekly to talk about reopening schools, keeping schools safe, and just a myriad of issues that surround those decisions. I'll say for Dr. Camp, since he didn't mention it, he is the president of the California African American Administrators and Superintendents Organization, which really takes these issues very seriously, and we discuss the impact of COVID on those communities and for our African American students in particular. So at the Alameda County Office of Education, and I'll tell you a couple of things that almost all of your county offices are doing, since I think we have folks who span the region on this call, is convening, as Dr. Camp said, superintendents from on a weekly basis, sometimes multiple times per week, depending on the news that is coming out and what needs to be communicated. One of the things we do in Alameda County is convene not only our district schools, but our charter leaders, our private school leaders, our specialty school leaders from around the area, so that everyone can have the most up-to-date information on school reopening, on testing, on vaccinations. Alameda County Office of Education was fortunate to be able to provide one of the first, actually the first mobile, FEMA mobile clinic to give vaccinations here, actually in the country. And one of the things that we saw was that our teachers and some other folks, administrators, people like me, don't have as hard a time finding out where those places are and ensuring that they're getting access. It's our other community members. So our classified folks have really have always been the backbones of our school, but certainly through this pandemic have showed up in ways that some of us couldn't anticipate to make sure that learning hubs were happening and students who needed it most had access to school. And those are the folks that often have a harder time gaining access to the vaccine and appointments. And so we ensured that we have multiple opportunities. Now we have a number of partners, some that have already been mentioned, but Safeway is another partner. A lot of local drugstores are working with schools to ensure that there is access. At this point, Dr. Bardock, and also I think the local public health officers would tell you that there is a focus on our hardest to reach communities and ensuring that the families there have the best access to vaccines. And in addition to access, since access is not always the problem, it's information. It's information about the safety of the vaccine. It's information about how many people have already been vaccinated. And you heard Dr. Bardock say you can't focus on vaccination enough. It is the game changer. So we are looking with the Delta variant at some things returning that we were seeing last year, but the variable that is completely different, that is game changing, is the vaccine. So we did not have that the last time we were looking at a resurgence of the virus in our communities and potentially in our schools, though there was a lot less COVID circulating in schools than there was in communities. And normally when it did show up in schools, it had come from households and communities, not from school communication, because we have spent a lot of time putting mitigation measures into place in schools, masking, distancing. I've visited scores of classrooms where different schools are using different measures, up to plexiglass dividers, different things. But truly it is vaccination and masking, and then spending as much time outside as possible. We are very fortunate in this state, for the most part, to have really good weather for a lot of the year, and you're finding that schools are using their outdoor spaces very creatively, certainly for lunch, breakfast, those sorts of things, but also for learning opportunities in many instances. So I will be happy to answer questions. I just wanted to give you a brief overview of how we're looking at this as educational leaders and practitioners in Northern California, but it really has been all hands on deck, and we've had to be nimble. And you can rest assured that there are a group of people who care really deeply about kids, who are thinking about these issues all day, every day on your behalf. So I'll turn it back over to Ms. Brown.
Thank you. Next, we'll hear from Dr. Lee Atkinson.
Hi, thank you for having me here. Besides being a pediatrician, I am a resident of Alameda County. I live in Oakland, and I have 3 children who attend public school in the Oakland Unified School District. So I share with you parents out there who are really thinking critically about the school year. The only comment I actually want to make to allow more time for the Q&A is the American Academy of Pediatrics put out a statement on COVID-19 in school. And I think this sentence really these couple sentences capture it. So I'm going to read it to you. Schools and school-supported programs are fundamental to child and adolescent development and well-being, and provide our children and adolescents with academic instruction, social and emotional skills, safety, reliable nutrition, physical, occupational, speech therapy, mental health services, and opportunities for physical activity, among other benefits. Beyond supporting the educational development of children and adolescents, schools also play a critical role in addressing racial and social inequity. So I think the issue isn't really just to only think about what are we doing for COVID safety at schools, which the schools are all doing. There's been some deep thought, but also the recognition of how critical being in person for education is, and mitigating the risk of the loss of access to those services by not having children be in person.
Thank you. And before we start our Q&A, we'll hear from Warren Parker.
Good evening. Thank you very much for inviting me to this forum. I'm excited to be here. My name is Warren Parker, and I'm a counselor at Dublin High School. My day-to-day role is, I act as a counselor. I am a dad, as well of 2 high school students and 1 college student. And more importantly, or just as important, I'm a football coach as well. So I coach athletes. And we also have to be concerned about the COVID situation in athletics, because it can definitely affect and has affected how we process and go about our athletics during the school year. On a day-to-day basis, my job and my role is to support our students, socially, emotionally, academically, and I want to get them on their pathway to determining their future. At our school specifically, we have established a wellness center. We are in our 3rd year of this wellness center. We just recently hired a wellness counselor to be on our staff, to act as a point person for those students that are in need. We also have established something that I think is probably definitely unique to our school, but a lot of schools are doing it. We have what is called a COST team, C-O-S-T, and that is our coordination of student services team, where any staff member or admin, teachers can, if they identify a student that seems to be struggling, they send a name to this COST team. This COST team meets weekly. It involves counselors, admin, and we look over the situation with these students. We reach out to these students to find out, are there any services that we can provide at the school, or any services that we can provide outside to give them the support that they need. Those students, that we discussed, they need this guidance. And as Dr. Lee Atkinson McAvoy said, school is important, and our students struggled during this COVID. I know that as a counselor, my role significantly changed. Trying to engage students to talk about college applications and letters of recommendation via Zoom it just wasn't the same as that one-on-one that I'm typically used to having. So I'm excited about the upcoming school year. I know that we're going to face a lot of challenges. We're gonna face challenges when a student gets ill or feels sick. They're gonna have to go away for possibly 10 days. And we're gonna have to get them their homework and make sure that they're still keeping up with their studies if they're capable of doing that, and then welcome them back into the school if they feel comfortable. At Dublin High School, we have invited as many students as are interested to come back face to face, but we've also introduced an independent study program for those families that just do not feel safe bringing their kids back on campus. The numbers for the independent study program at this time are relatively low, but I would imagine that as we progress through the school year, that we'll have a lot more parents that are interested in navigating that way. But I am proud to be a part of the education system. I'm proud to be a part of Dublin High School and Alameda County. I think the information that we have that comes about has been outstanding. And I look forward to the school year and supporting our students. Thank you.
Thank you. Thank you for the panel for opening that up with some great comments. That cost program sounds really effective, and I hope that parents take advantage of that and students as well. We're going to jump right into the Q&A. I think you just answered one of our first questions that says, will parents have the option of not sending their kids to school and instead choosing distance learning? I think you just addressed that they do have the option. And it says, if yes, what are the steps to get the request to submit their request for the choosing distance learning?
Yeah, I can briefly touch on that and just say you probably need to check with the particular school or school district, probably the school. That's where they start with making a request, and then there likely will be some analysis program and a conference before a student is enrolled in an independent study type of a program. My only caution, and I only share this because I want for all of our what's right for the family, but for my family, I look at the potential risk of holding students out of school and having them go through independent study versus in school. And I'm telling you, I'm ready to take I'm ready to take the risk because I think there's a greater danger right now of holding the student out on the social, emotional side of things. The things that were mentioned that connect kids. We used to take them for granted, right? The kids go to school and they come back safely, but a lot is happening during that time period of kids and how they're going to interact with each other. The access to their peers, to caring adults, the access to athletics and extracurricular program. Those are all critical for maintaining students and helping them to grow. I think of too, the younger they are, we know how important it is for kids to be able to read before they get to fourth grade. And if you start pulling away those years, they only get, let's say they get 13 or 14 years if they go to TK in our system. And you think about, you take away 1 year, then 2 years and 3 years, and all of a sudden they're learning an independent study. But I think I don't want to undervalue what the kids get social and emotionally and access to our system. So I think it's a worse. And the other warning too is this. I know we started out when COVID hit thinking it was maybe a week or two. I remember those conversations back in March. And then all of a sudden we realized that, oh, okay, these are a lot of months that we're going to have to consider that, right? And now we're thinking month, vaccinations, hope. But let's be honest, we don't know how long this is going. we just don't. So think about the multiple year possibilities. If we're dealing with COVID-19 or whatever it is in 2030, how long can students be out of school and what are the impacts of having students out over multiple years? So thank you. Hopefully I answered that question.
I think you absolutely did. Thank you. Another question, with Delta variant highly contagious and cases increasing, why is social distancing not being mandated at elementary schools to help keep the unvaccinated youngest students safer? And a second part of this is also, why is regular testing not being mandated for teachers and students?
Maybe I'll start with the social distancing, the physical distancing piece of it. So there's no minimum physical distancing requirement in schools. And that's because it's actually based on data that has shown that in the context of having those other layers, the school can be safe even without a minimum physical distancing. And that's data from North Carolina across a lot of districts, like almost half their districts in the whole state participated in, I think it was April to June of this year. So already with a little bit of Delta variant in there, showing that the physical distancing was not actually like a key. They didn't have any minimum physical distancing. They had masking, they did ventilation, et cetera. And so they actually found that there were very, very, very few cases, and there weren't cases of in-school transmission, which is what the physical distancing would be about. So, and then the other piece is that we know that not every school in California and many schools in California are not able to do full in-person instruction, full in-person learning, if there's a minimum physical distancing piece in place. And so that speaks again to the things that Dr. Atkinson McAvoy just talked about, and Superintendent Camp, as well as Mr. Parker, about how important that in-person learning is. So those things sort of taken together, that is how we know that safe and successful schools are going to be done in this coming school year.
Thank you. Second part of that question is, why is regular testing not being mandated for teachers and students?
Want to go ahead?
I feel free to chime in, because there's both a school district part of this, and then there's a public health part of this. It's certainly being recommended. There is at no point, or there has been no point through this pandemic where a particular regimen for testing has been mandated. Some have been pushed for, but there have been recommendations, and most school districts at the outset, one of the things we did in Alameda County was negotiate a county-wide contract for testing, but districts have to ramp up to setting up their infrastructure for testing. So for some, that was very often. For some, it was every 2 weeks. I'll just say, as an example, for the county office, we were doing it every other week. Now, when we're looking at opening schools and greatly expanding the need for testing, because students, where they haven't been in a lot of districts, will be back. So we're looking at various options for testing. Many of the districts now are using the state option for testing. So you will see, as schools open, a regimen for testing. How often it is and what vehicle is used will vary from district to district and county to county, but districts really realize that it's something that needs to be put in place in addition to all of the things that are being put in place currently. So they'll need to assess, how many students there are, what the number of faculty is, and who is going to administer the test. That's going on in real time right now. And we actually are very lucky in California to have a robust investment in testing. So there will be testing, but it will vary according to context. I don't know, Dr. Bardock, if you want to add anything to that.
Mm-hmm. No, that was a wonderful summary. Yeah, different counties have different situations going on, and actually a lot of it is that depending on where the case rates are, meaning how many cases are going on in the community, the recommendations for testing might change. And so because of that, there's no requirement. And just to help clarify, there's required things, and then there's things that are recommended or things to consider doing. And so the recommended things, there's some flexibility for people to say, oh, well, we don't need to do testing right now because our numbers are really low. Or, hey, we'd like to know what's going on, so let's do some testing. Or, oh, our cases are like, the community has high numbers, let's definitely do that testing, right? So it kind of depends on the situation and the resources there. And then people get to use it as a tool in order to make their decisions depending on what's going on around them locally.
Thank you. We have a funding question. Is the $25 billion just for Alameda County schools alone? And how much will be allocated to OUSD schools?
I'll start with the first part and then maybe somebody can answer the second part. The 25 billion is for the whole state of California, schools throughout the whole state of California. So it's not just for OUSD. And those are dollars that come both from the federal government as well as from the state government to be able to really support schools. But it is across the state for all the different school districts. Good question.
I'll see if I can, we do have Oakland's number. I just don't have it committed to memory. So I will see if I can get that for you at some point before we end the call.
Perfect. Thank you. We have a couple questions that are talking about, aren't most of these studies based on variants that were common earlier in the pandemic? And do we have data specific to Delta and other more transmissible variants?
So I'll start out with that, and then Dr. Atkinson, McAvoy, also if you have anything to add. A couple things. So the ACE2 receptor study, the one about the doorways, and that the doorways are that elementary school students make fewer doorways compared to middle and high school compared to adults. That's true for Delta as well. We're seeing that same thing, which is that the difference between contagiousness differs by age group in the same way for Delta, meaning that kids are less likely to get it and transmit it compared to elementary, less likely than middle and high school, less likely than adults. So that piece is the same. The other piece that we're seeing is that there's the information we're getting right now about and I'm seeing some questions in the chat actually about this. There are other states in the United States that are having very large numbers they're in a big surge. And when you have a big surge in a community, you're going to have a lot more people hospitalized, adults hospitalized, and people getting sick. And that will mean that there will be more kids who are also getting COVID. So there are higher numbers of kids getting COVID because of the Delta variant right now. The thing that I think is important to sort of highlight or talk about is that the states that are really getting affected the most are states where they have actively banned using masks in schools, and they have very low rates of vaccination in their adults. And so it's those things together that are actually really, giving Delta that opportunity to really spread. What we're seeing in California, we, very specifically, we're mindful of this variant. And so that's part of the rationale for universal masking, really important. It keeps kids safe in school, it keeps adults safe, and also a much higher rate of vaccination. So other states are like 8% vaccinated compared to California, which is, much 50, 60, 70%, depending on where you are in the state. And some places even 90, depending on where you are. But so it's helping to put those numbers in context and how important it is that we have these safety layers in place in order to keep our kids and our schools safe. And the last thing to say is that we are watching even numbers very specifically in hospitalizations in kids in California right now. And we are seeing no increase in hospitalizations. Hospitalizations in COVID are extraordinarily low in kids anyway, like in the single digits. And we haven't seen any change, even though we're with about 80% of COVID right now is Delta variant in California. So hopefully that's helpful to put those numbers in context and give a little bit of reassurance there.
And just again, to also add on to what Dr. Bartek said, we also still see that the children who test positive for COVID-19, whether they're symptomatic or asymptomatic, have a household contact. So the same sort of information we saw a year ago is that children are more likely to get it from their adults with whom they live, as opposed to children necessarily being the source of bringing it into the home.
Thank you. SLUSD is allowing elementary age students to eat briefly in an indoor cafeteria. The district has told me brief unmasked periods for eating are okay per Alameda County Health. COVID does not have a stopwatch. Why bother being safe in the classroom and then throw caution to the wind at lunch? They're very worried about this and they want to know how this is possibly safe.
I'll turn it over to our medical professionals next, but each school district, as you know, I briefly referenced, and maybe Dr. Camp has some context from San Lorenzo to after that. And I'm assuming this is San Leandro Unified School District that we're asking about. But each school district has made sure they have a set of protocols. It depends on, a lot of them will have doors and windows open. A lot of them have very well ventilated cafeterias. You would really have to know what the context is. Some of them are having half the number of students that they would normally have in a cafeteria during lunchtime. And others of them are having part of the students outside, part of the students inside during that time. So while I don't know this specific context, given that I know what so many schools are doing, I'd be really surprised if this was business as usual, that we have the same number of students with the same conditions that we had prior to COVID. But I would need to know the context, and I'm sure that raising this with your school district will not go unnoticed. So Dr. Camp, maybe you could add to that a little bit.
Yeah, I think Superintendent Monroe, and that's accurately stated, it probably varies across different school districts, and you're dealing with a set of circumstances, and you're making your best decision with those set of circumstances. I would imagine that schools are definitely differentiating from what school was like in 1819. But that doesn't mean that there's no opportunities for kids to eat during the school day. We can't even, I mean, obviously the short-term solution, when we're preparing for them at our sites, we've created some outdoor eating spaces. But once again, we're going to have to balance that with the circumstances that are outdoors, right? We might go through a fire season at some point this year. So what will that mean? We have kids coming to campuses and they need to eat at some point. So what are the safest conditions we can place the students in as they're eating? And just to reiterate a point, though, I just want to lift up what Dr. Atkinson McAvoy expressed. We listen to the data, and we're going to keep learning from our health experts along the way. And the data is suggesting that, once again, kids are more likely, if they're positive for COVID-19, that they probably have a contact at home, not in the school cafeteria. And you know, we benefit. There are several school districts in several states that have kids back. They've had them back for months now, months. And our scientists, our public health scientists, are learning from those situations. So once again, as we continue to learn, we'll make adjustments as educators. I can tell you, every superintendent in Alameda County has been involved in a lot of meetings. You know, I would, I know it is, at least multiple times per week on these subjects. So we're arming ourselves with the information so we can obviously place our students and staff in the best situation possible.
Thank you. And to piggyback on that, just to clarify, are classrooms implementing social distancing?
You know, this is another one that probably varies across different districts. The points that have been emphasized in this call will be emphasized in the classroom. The mask, right? There was previous guidance about keeping kids 6 feet apart. But once again, that was the guidance then. The scientists learned, the public health scientists learned, and then there was a conversation about 3 feet, and then we continued to learn. And if you keep kids at a certain distance, then you can't keep the classes open to students 5 days a week. And so what do? You try to mitigate as much as possible. Yeah, you obviously try to keep kids as separated as possible for as long as possible. And then the mask. It turns out that we're learning, once again, from other school districts, that mask is huge. Mask is huge. Good ventilation is huge. And of course, the vaccinations. Those are all strategies. So if you can't keep kids 3 feet apart or 6 feet apart, but they're wearing masks, I think what the scientists are saying is kids got a pretty good shot of being healthy, right? Pretty good shot at it. There's no, I mean, I don't mean to say this as a joke, but the reality is, if we wanted 100% certainty, we think we know how to do that. You don't let kids interact with anybody, family included, at any time. But that's not going to be good for a kid on the social, emotional, and academic learning side of the equation. And that's what we're trying to balance right now. So obviously trying to support the kid while keeping them as safe as possible.
I would just add, I think one of the downsides of the Swiss cheese model is everybody assumes each slice is equally thick and equally beneficial. And what we know, and this is why Dr. Bardak made her last slide the way it is, the vaccine slice is pretty thick and has fewer holes in it. The mask slice is also pretty thick, fewer holes in it. And so again, if we can vaccinate our adults, our teachers, our parents, our families, the 12 and older who are eligible to be vaccinated, and the younger kids when they come online, and we do universal masking in schools, those two measures will keep schools safe.
With that said, would you recommend, I know with some of the guidance earlier on, they were talking about double masking. Do you think the kids should be double masking?
I think the best mask is going to be one, it should at least have the minimum that it is a mask. It can't have the ventilation, none of the gaiters or some of the fabrics that were known to not be effective, but it's going to be a mask that your child would keep on. So there are some masks that have multiple layers in it, which might have either N95 inserts or material similar to surgical masks. But if your child can't tolerate it, and they're going to take it off or fiddle with it, then we should just do a regular cloth mask that they can keep on.
Perfect. Couple of questions about, will this presentation be available? Just I'll let you know that at the end of this presentation, I'll provide you with the Safe Schools for All website, the parents page, where at the end of the week, we will start sharing recordings from the panels. So you will be able to view this panel. There's a question about, has anyone assessed, we touched on it a little bit earlier in the opening comments, but has anyone assessed the impact to the mental health of students if they are moving in and out of quarantine during the school year? What is the impact of this kind of instability on children?
I'd be happy to take this first, and I think that almost every one of us could speak to this in some way or another. First of all, it's hard to quantify. One of the things that I will tell you, though, that is a quantifiable measure is the great drop off in CPS, Child Protective Services reporting during this time. So as has been stated, schools are really the first line of defense for some students who actually need that kind of nurturing and protecting from their schools. And not being in school in person has distanced them from that support. So that's one data point that we have. But we're hearing from teachers everywhere across the state who are seeing students, just observing students who they do have on Zoom or by talking to them at other times, that there are situations that they perhaps are concerned about, or having them share things about their daily lives or their thoughts. I mean, our teachers are doing an incredible job of trying to do the things that they do in classrooms that are so important via Zoom, asking those key questions and really giving kids an opportunity to reflect how they're feeling and doing. What we know as educators, we're not going to know the full magnitude of this until we get our students back. We know some things, but when we see them in person and when we have a chance to really discuss and triage and really have them be immersed in in a healthy school culture, that's when we're going to find out. At ACOE, at Alameda County Office of Education, we were on our way to developing a social emotional learning department prior to the pandemic, and we stood it up during the pandemic, and we are understanding now from all of our school districts and others as well, what some of those needs for support are. You heard Mr. Parker talk about cost, coordination of services teams. The other thing that many schools are engaging in, there's funding for something we call, another acronym, be careful, MTSS, multi-tiered systems of support. So looking at what student needs are in the classroom, what student needs are that need to be addressed with additional supports and helps, and then those students who need the most intensive kind of support. So schools have been trained on this, and more schools are trained every day. It's a huge area of focus for us, and there's funding for it, which has not always been the case.
Thank you.
And maybe I'll,
Somebody want to add something to that?
yeah, I'll just add one thing. Thank you so much, Superintendent Monroe. It was so helpful. I think also the question specifically around quarantine, about coming in and out of the classroom, I think is the other piece that the CDC guidance actually allows for, as long as the exposure for somebody, a quarantine happens when somebody is exposed to another person with COVID-19. If both people in the exposure, meaning somebody is sick and there's another person who's close to them for more than 15 minutes, etc., if they're both wearing masks, the CDC actually allows for the kids to stay still in in-person instruction. And the way we're doing it in California is stay in in-person instruction as long as you're doing testing twice a week. So that actually was trying to actually address this concern of kids coming in and out and having that disruption. Some schools might use that option, some schools might not, but I just I think that it's another thing we're learning is trying to figure out how can we do COVID schooling, like schools with COVID safely, keeping kids in school as much as we can. And that's where the masks can really also be helpful in addition.
Thank you. If a student, and Warren Parker actually touched upon this briefly, if a student is infected and tests positive and he or she needs to be isolated for at least 14 days, how can that student catch up with the schoolwork in that case?
Well, ideally during that period in which the student is not in school, there's some communication with the teacher, and as the student is able to do work, there's some correspondence and an exchange of information and work assignments during that period of time. So we've had students out of school for illness reasons, before the pandemic, and obviously there are attempts in order to keep the learning going, or some learning going during that period of time. Prior to the pandemic too, I know a lot of schools I'm thinking secondaries had policies that if a student were out for 5 days and they get 5 days in order to make up assignments, a lot of schools have already made those type of arrangements. I would say this though too, that in the education community, I think we've become even more sympathetic or empathetic. Let's go empathetic with students that are out of school, and there's an acknowledgement that we need to do things differently in order to support the students. And that's, again, we've already been doing that, but I think it reached the point this year where our legislature actually authored a bill, the Assembly Bill 104, that said we need to support students that are struggling. I'm really talking about at the secondary sites. Well, actually at the elementary too, in terms of retention options and that. So I think the school sites and the teacher are very sympathetic, and our teachers want to do what's best for our kids.
I agree. I think that, the plans are still being formulated with regard to, how we're going to address these issues. And, as a counselor, I fully advocate for the students and support the students. And I hope that there is a plan that we have in place. I know that our school site, we're going to be having a staff meeting next week before our students arrive back on the 16th. And I'm sure that that's going to be one of the topics of conversation with regard to how are we going to support our students who are absent for X amount of days. But I can say this, that throughout this pandemic and throughout this distance learning process, I have been thoroughly impressed with the technology. It's opened my eyes to the possibilities of things that we're able to do. As a counselor, I hold 504 meetings, I hold IEPs, and I will say that through Zoom, although Zoom has taken its knocks, I probably had a ton more participation from parents, faculty, students via Zoom because it just seemed more convenient for those parties. And so I just think that we have to be willing to take advantage of the technologies that are available and use them to their utmost.
Thank you. For kids, and I know this is a common question, is there any updated information in regards to how close we are to finding or approving vaccines for students 11 and under?
So we can only say what we have heard, but according to Pfizer, they're very optimistic that the data is going to be coming out this fall. It will be undergoing sort of FDA review. The FDA added additional time of assessing for side effects in those age groups than they had for previous vaccine release, which is why it feels like it's taking longer. So we anticipate this fall, and fall can be as late as November, but anticipate this year, 2021, it will be approved.
Well, that's good news. Thank you. For this goes to day, are their temperatures being checked every day? And part two of that is, how often will they be tested? Are they being tested weekly? Is this something that works differently for each school district? How is that working?
So I would love to hear Dr. Atkinson McEvoy or Dr. Bardock speak to the recommendations around temperature taking first, and then I can tell you how schools are navigating that. And I do think we did address the testing question a bit, but I'm happy to add to that.
I'll start, and then Dr. Atkinson McEvoy can follow if she wants. So the temperature taking is something that we all were doing in the very beginning of the pandemic. There were a couple of things we did in the very beginning of the pandemic. Lots and lots of, if you guys remember, lots and lots of wiping things down, wiping down vegetables. I don't know if you remember doing this, like wiping down our fruits and our things that we bought when we were grocery shopping and all that, taking off our clothes when we came home, that kind of thing. And because we thought that that was actually going to be a way of preventing the infection from transmitting. The washing thing was because we thought that it was actually going to be on surfaces, and it turns out it's that airborne, it passes through the air. The temperature taking was the same kind of thing, that people thought that if they could find people with fevers, that would then be a really effective way of figuring out where COVID is and then catching it so that there wasn't transmission. And it turned out, after all of us did it for a long time in hospitals and schools, et cetera, that it wasn't an effective way of finding COVID cases. And so, and it was a lot of work, and so it was a lot of work for nothing. And it took away resources that we can use for those other layers that we do know are effective: the masking, the ventilation, the hand hygiene, the hand washing, staying home when sick, all those things. So that's why there's no temperature checking anymore. It's just because we're learning through as we're figuring out what's going on with this virus.
I just want to emphasize at the start, scientists and physicians and the CDC made their best guesses on how they thought this virus was transmitted. And we had to use the data and evidence to sort of say what works, what doesn't work, what's more effective, what's less effective, to also really think about not only cost effectiveness, but what's reasonable. Is it reasonable if I go to the grocery store infrequently, so buy more, that I'm wiping down a month's worth of groceries? And we found that really didn't make a difference, so it was really the simpler things that made a difference: hand washing and masking. And we continue to pay attention. We continue to pay attention with the variants also as they emerge. Are they somehow evading the immune system? Are they acting differently? And once we know those things, we share those things. And what we are talking about today with schools being safe It's based upon how the virus has behaved to date and what we've known through many studies, many data points, many sort of questions around how the virus actually acts in real life.
Thank you for that context setting. That's so important because you'll see different things in different schools as schools are beginning to define their policies. One thing that you'll see across most schools that I'm certainly seeing are added hand washing stations. There are a lot more remote or mobile hand washing stations for students. Some schools are still doing some temperature taking, but there is much less of that. What you'll see more often is certainly for staff and for some students, but is a health form. So a health screening form, you need to say that you are not suffering from various symptoms, the symptoms that are associated with COVID before entering the school building or the district office most frequently. And, one of the side benefits, if you're looking for silver linings in COVID, there aren't a lot, but a couple are that we frequently remark that most of us haven't had a cold, because we've been wearing masks when we're in the presence of folks. And so one of the things we know we're going to navigate as educators, this will not be a surprise. Children have runny noses. They do have illnesses frequently that are very common. And what we want to make sure of is that we are addressing those appropriately and not keeping kids out of school or away from schools. Or closing whole classrooms because of sniffles or the things that are normal allergies. So it's going to be difficult. We're going to have to navigate those things as we go. But those are some of the variables we're looking at, and temperature taking is no longer the most important criteria that we use to decide whether students healthy enough to be in school.
Thank you. I believe this question is to Dr. Bardock because you had the slides. It said, a previous slide said, if indoors and unvaccinated limit time. Elementary students do not have the choice to be vaccinated right now. Should the instructional day be shortened?
This is an interesting question. I'm not sure exactly what that slide was talking about, but I'm happy to just generally talk about, indoors and time and all that. So one of the useful things that is that indoor time, outdoors is safer than indoors, but we also know how to make the indoors a safe environment. Particularly the ventilation actually is a really important one, as well as the masking. So I think that piece that we don't talk about ventilation because it's harder to see, right? We see our masks, we think about that, we wash our hands, right? That's all sort of apparent, but the ventilation is actually a key piece. And I know many, probably almost every school in the state knows about ventilation, has been thinking a lot about it. And so I would encourage people to talk to their schools about ventilation and what are they doing. And there's a range of different things you can do for ventilation, but I would definitely emphasize that rather than a shortened school day doesn't seem to make it there's no science that sort of says, oh, the shortened school day is like a key piece of it. And it's probably partly because the elementary school students tend to actually go outside a fair amount. I think to Superintendent Monroe's point, that's a lot of, that we use the outdoor space. A, we're in California, so we're very lucky in that way. And then B, because it's great developmentally for kids. So that would be sort of the way that I would think about that piece.
Thank you. Here's another one. I understand that the school attendance formats and safety measures has evolved as the vaccine has had some traction and the science has progressed. What kind of contingency planning is in place to address changing conditions due to the Delta and maybe future variants? So as I read that question, it might be more about attendance. Is there a different type of approach for students' attendance that's different from previous years in retrospect to the actual pandemic? And I hope I'm reading this person's question correctly. I'm reading it correctly, but I hope that I'm interpreting it correctly as to what they're asking.
Dr. Camp, what
You
are
know,
you seeing?
Yeah, my only thinking was, I think prior to the pandemic, we as schools would tell parents, can your kid come to school if, and there was more of a scrutiny attached to being sick. If you can come to school and kind of stick it out, then we sort of encourage you to do that, right? And I would say after the pandemic, it's gone the other way, that if you're sick, you think you're sick, probably better for the whole to stay home. And that's happening in schools real time. As far as if the circumstances arise that would say that we need to, change our approach to schools being open to students, I'm just going to suppose that our our public health officials will be in collaboration about that because they're learning as we go, right? We're much smarter. Our public health officials are much smarter right now than we were a year ago, and definitely much smarter than 18 months ago as it relates to the virus. And you brought about a good point. We're talking about the Delta variant now. If my letters are correct, I think Epsilon might be next. So what might we learn when that comes? And that's why I say, let's give each other some grace, some time. Let's listen to the scientists, be comfortable with being a little bit uncomfortable and uncertainty, because we're going to keep learning. And I think in a society where you keep learning and being willing to make adjustments after you learn is actually probably better, right? You learn information. I think my mom used to say, was it my grandmother? You know better, do better. That's what this is going to be like. And I like I said, I don't think we're talking about weeks and months. I think we're going to learn for multiple years. I think we discovered something. I mean, Superintendent Monroe mentioned, I think we discovered something that we didn't acknowledge before. Boy, wearing masks, we didn't have our flu season last year, as many of the experts were predicting. So we learned, right? And I suspect that even as the novel coronavirus, hopefully when we get to a point where it's not a part of the daily conversation, we might still have masks during flu season, right? And many of our Asiatic countries already had that type of a societal norm. So I think we're going to learn from each other and from our health experts and make changes appropriately.
I want to just also highlight one of the things is we falsely assumed children were going to be the most important vectors for this virus. Mm-hmm. And as a society, and as many societies across the globe, we made an elective decision to close schools because that was going to be ground zero. There were a few countries, a few locales within our country that bravely reopened to in-person learning and demonstrated on behalf of everybody that that was not true. And at the same time, by not having in-person school, we've seen some tremendous costs to young people. And education and access to education is one of the most important measures of success in the life of children. So as we're thinking about safety, I don't want it to be, let's keep them X feet apart, or don't send them to school, or shut schools down altogether if Lambda or whatever variant is bad. But how can we maintain this? Because as a pediatrician, I am very worried about the impacts of this 18-month hiatus from in-person learning on children. And even if my 3 kids seem okay now, we know from science that the impact can show up for them up to 5 years later. So we're weighing 2 harms. We're not weighing 1 harm versus if we just keep them in their living rooms on Zoom school, they'll be okay. And so that is what public health experts and educators are thinking about. So if whatever surge is in front of us, we are actually going to be measuring 2 potential harms and making a choice on what would have the best possible outcomes, what would be safer, as opposed to there's a safe thing that we're all avoiding in a hurry to get kids back to school. Like that scenario does not exist. The scenario is the harm of not having in-person education versus the harm of the virus.
Thank you. We're at 7:23, and I want to try to get to two more questions. Not sure if we will, but I want to make sure that I address this question, and I think it's pretty important. And this is probably for our doctors. What do you suggest that severely immunosuppressed parents, parentheses, cancer parents, etc., do at home to protect themselves from being affected by their children who are in crowded schools, especially those under 12? Should we wear masks when our children are at home?
So it's hard to answer specific medical questions without knowing the specifics, but I want to say that immunocompromised adults were actually early sort of recommended to get the vaccine. So I would say for anybody who's got any health concern, having a conversation with your physician around whether you're eligible for the vaccine, if you've gotten the vaccine, and where you are in your treatment course. I think for your children being at school who are not yet vaccinated, making sure they have a mask that's effective. That's somebody who maybe 2 masks or 2 layers or a surgical mask that fits them is an important piece to sort of work on with your child while they are in school, are some helpful ways to sort of minimize that. But I have these conversations with my families. And so if your child has a pediatrician, have a conversation with them. If perchance your child doesn't have a physician, discuss it with your physician around specifically what can be done, because a plan can be made.
Thank you. Before we end, this is an interesting question, and we might not have the answer here. There's someone that says, are there any learnings across the country of school districts or schools that can give us some perspective about how going back to in-person learning will work? And there might not be an answer to that, but I just want to make sure I pose that question.
Well, I can start with this, California. I think our physicians may know more about the research across globally, but in California, in some of our outlying areas, we have schools that never did close. They just kept going. Largely or primarily smaller districts, fewer kids, sometimes mixed age groups, but they just didn't close. So I frequently hear those county superintendents talking about this reopening as a misnomer. They said, we never closed. So we're just looking at putting the measures we need to now put in place, but we are continuing to move forward. And other than minor situations where they had to quarantine for a staff member or student who was presumed COVID positive, they were uninterrupted. So what we learned a lot from them. We really did. We learned that they didn't, COVID did not run rampant through their schools, that they were able to continue learning, and that they, for the most part, did very, smart, measured things when they had to address a situation. So hearing from them on a continual basis was a great help to the field. That was in California. And Ms. Brown, if I could just say here, I have the number for OUSD before we end.
You want to go ahead and share it now?
240 million is the initial apportionment that Oakland has received for COVID mitigation funds, or they've been called all kinds of different things, but that's the initial amount.
Perfect. And for those who might not know, that was for a question earlier. Someone asked about Oakland Unified School District and funding. So I'm going to ask this last question because I think it's an important question, not just for schools, but just across the board. We hear it all the time, and it's regarding booster shots. Someone says, my understanding is that the effectiveness of the vaccine starts to diminish after 6 months. Are there any updates about the booster shots?
Maybe I'll start and then Dr. Atkinson McAvoy can also chime in. So Pfizer is looking carefully, and the CDC, which is the National Scientific Advisory Body for the United States of America, is looking carefully at whether or not there's any indicated need for a booster right now. And so far, nobody has said like, oh yeah, definitely, absolutely. So as we continue to watch the data, we continue to try and figure out the answer to that question. But it's a great question. It's ongoing, and we're just still trying to understand what the answer is. It does look like people's immunities. There's two kinds of immunity that you might see, and you might have heard about, which is sort of antibodies, which is something that can show up in your body that says, hey, I know how to fight off COVID-19 or SARS-CoV-2, the virus that causes COVID-19. I'm all ready to go. And there's another kind of immunity, which is called T-cell immunity. You don't have to remember these names, but it's basically sort of like, I'm ready, but I'm not like, it's not like I'm ready because I know how to do it. And I'm ready to go once I need it, but I'm not it's a kind of the computer program. So it looks actually like that computer program, the T-cell program, is actually also pretty long lasting. So it kicks into gear once it sees the virus, the same way those antibodies that are already sort of floating around are fighting things off. And so it's actually, that's why people think that there's actually some long lasting immunity, is actually that T-cell immunity. So there's two different types of immunity, and it looks like that's actually part of the reason why it's like, we don't seem to be seeing any obvious signal that we need boosters, although we are continuing to watch it very closely.
Thank you. We're at 7:29, and before I close and thank the panel, I want to turn the floor over to Dr. Bardock for some closing comments.
Yeah, thank you so much. Huge shout out and gratitude for everybody here at this webinar, as well as the really amazingly important questions that people put in the chat. I'm seeing somebody saying in the chat just a real appreciation for the questions that they might not even have thought to ask that they're hearing in this webinar. So thank you guys for your really thoughtful questions. And to all the leadership that's on the call for really helping to support safe schools. It's so important, and it's a lot of work, and so really acknowledging and lifting up all that work that people are doing, really appreciate it. And then I also, as a pediatrician, I like to sort of give people a couple of things to take home, to feel like, okay, I'm a parent. What am I going to do? What's the to-do list that I can feel like I have some sense of control and something to do? First of all, just to remind you, we're a community. We're in it together. What you do for your kids is really important. You're doing it for your kids. You're doing it for other people's kids, for other people in the community, reminding each other of that. COVID is the enemy. We're working together, and helping your kid to hear that, because as they go to school's going to be different. Prepare them for what it's going to look like, masking, that there's going to be a different feeling in school potentially, but that they're doing it together, and what they're doing, washing their hands, all that is helping not just themselves but other people also stay well. A couple other things, get vaccinated. It's another tool. If you're having questions, there are a lot of people who have questions. That is normal. It's a great idea to talk to your doctor, your own personal doctor, or do some reading online. The CDC has great stuff online. Try and go to a place that has good, these national advisory groups. CDC is really smart. They just have a lot of good science. So going there and getting educated, and then empowering you to ask the questions about what does the safety plan look like at my school, and feeling like you have an understanding of what's going on that gives you the confidence to say, okay, I understand, and I can support my kid to go to school and have a good school experience this year.
Thank you.
Yeah.
Before we close, I want to share this slide. I mentioned earlier that you can go to the Safe Schools for All website, the parents page. These recordings will be available, I believe, at the end of the week, so you can go back and review them. You can look at other school districts as well, but you can also find ongoing updates, key resources, and information related to what we've been talking about tonight. For those who don't have internet or digital know-how, there's a hotline, and it's 833-422-4255. And I'll leave this slide up as I close so you can screenshot it or write it down. I want to thank our panel. This has been an awesome panel. I think that this mix of individuals was really perfect to address some key questions. And I know we couldn't get to all the questions. And one of the other panels that I had, that I facilitated or moderated, I should say, there was a very, very passionate school administrator who encouraged parents to engage with their schools. Go to your schools, ask these questions, get these answers. We could only get to so many questions, but don't let it stop here. Be very proactive and be involved, and make sure that you're doing all that you can do to make yourself feel better, so that you can make your student feel better, and so that you can make the right choices for them. So with that said, again, thank you to our panel. I appreciate everyone's time, and I wish everyone an awesome evening. Have a good night.
Right. Good night. Thank you.
Thank you so much. Good night, everyone.